Good afternoon, everyone. This is Diana. We're here at the Hunger Solutions New York office, and we're going to get going in just a minute. The one thing I'm going to do is I am just going to ask for a show of hands for anybody who has used GoToWebinar before. Would you just raise your hand to let me know that you can hear me? Yeah, okay, thank you, Lisa. All right, and that you can see the screen. The screen should say, welcome to the WIC Quarterly Report Review Webinar, and give you some computer instructions on how to access the audio. Oh, I'm sorry. There, now you should be able to see that. Many apologies. Okay, everyone. We're glad you could join us today. We'll get going in just a couple of minutes. We have a couple more folks who are going to join us. And I also want to take just a minute or two to leave this up on the screen because we had previously used a different call-in system, and I want to make sure everybody is able to access the audio on the webinar and know how to do that. So I'm just going to leave this up here for just a minute. And also wait just a minute until a couple of more folks join us. Okay, I think we'll get going, and we'll just start a little slow rollout here. The first thing I'm going to do is, some of you may not be familiar with GoToWebinar, and I just want you to look to the right of your computer screen, and you'll see a little orange arrow. That arrow, if you pop it out, you'll be able to see there that you can choose a phone call and how you access the call, or if you want to use your computer speakers or your headphones, just choose computer audio, and you can also hear this over your computer. Now, as far as questions go today, and I will repeat this again in a couple of minutes when some more folks join us, we will take questions periodically, and the way we're going to do that is you'll see a questions box in your slide out down towards the bottom, and we'd like you to type in your questions. Type them in as you go along so you don't forget anything, but we'll take them periodically and we'll stop, we'll look at those questions, and then we will try to answer as many of those questions as time allows. Also know that there might be a question or two that comes in that's really specific to your service area, and as a result, Kara may reach out to you individually to answer those questions if it's something that's specific to your particular service area. So again, for questions, we'll take them periodically, and please type your questions in the questions box. Okay, so let's move into our actual webinar and do a couple of introductions here. Today, what we're going to do is we're going to go over your quarterly report form. Now, this form you just received in your email from Kara, and in the office today, we do have Patty Duell, the Assistant Director of Field Operations, and Kara Williams, who is your WIC Health New York Program Contract Specialist. I got all of that out.
Hi, guys. How are you?
So what we're going to do is we're going to go along and we're going to walk through this form step by step. It's a new form for us. It's a new form for you. And so we're going to go through this line by line and take our time to really understand this form. The other thing I'm going to say is when you look at this form, it's up on your screen. I don't want you to panic. We know that many of you are just getting started. And so you might look at some of these numbers in here and say, oh my goodness, I'm behind. We know you're just getting started. Don't panic. We want to let you know how to use this form today, go through it step by step, and also let you know that we have still quite a bit of time to work on these numbers, and we'll talk more about that in a minute. but we have no expectation you're going to have a lot of numbers for the first 2 quarters, October and November, because of the fact some of you are just getting going. Okay, the other thing I want to say, and I'm going to reiterate this again later. As we go through this form, it's important to know that none of the numbers that we've entered here really may relate to any particular WIC Help Specialist, WIC Help New York program. We've made these all up. These numbers are totally fictitious. Even though this first example we use is the Albany-Schenectady County area program, these are not the Albany-Schenectady numbers, not in any way, shape, or form. We're just using this as an example. Okay, so let's get going and let's take a look at our form. And again, as I said, we will stop periodically and we will stop and check for questions. Okay. So let's start at the very top. Here's your main target formula form, and this is on your very first tab on your main target page. If you go down here along the bottom, you'll see main target and pre-screen. And then as we go along, we have other tabs where you will enter other types of information. But we're starting on the main target and pre-screen tab. So this is your main target formula, and this is the page, the first page of your form. You're going to see agency name, service area, and date. All of these will be entered by your contract manager, Kara, when you get your form. So when you received your form in your email, you'll see this is already filled out. And you'll see some other things filled out too for you. Now we're going to move over here to something that's extremely important, and this is your main target. Okay, this is your main target number. Again, this is a fictitious number. We're just making this a nice round number for an example. The main target number, the number in this box reflects your agency's total main target for the contract period. And this should match the number on your agency's program target sheet that Kara has reviewed with you. The main target number, this is really your goal. By the end of our 20-month contract, and again, we have 20 months, by the end of your 20-month contract, you'll want to achieve X number, in this case we've put in 400, number of individuals to receive WIC as a result of your really great work as a WIC Help Specialist. So this number is achieved over the course of the 20 months of the contract. Now we're going to move down and we're going to talk a little bit about this next section, the pre-screening section, pre-screening information. You'll see that this is a quarterly report broken out by months, October, November, December. Your next quarter will start in January. And when we get into the next quarter, you'll get a brand new form from Kara with your main target number in it and all your information filled out, again, from name of agency on through date. And also, you'll have in there, as you do now, the WIC agencies that are in your area. Remember that, just keep in mind, I should say, some of you may have only one WIC agency in your area, in your service area. Others may have several. We've just chosen to put in 3 here and use the Albany-Schenectady County as an example just for WIC agencies, again, not for numbers. So pre-screen, this first line is the number of individuals that you have pre-screened. So what is a pre-screen? It's the process of determining if an individual is potentially eligible for WIC by collecting information about the individual in the household. For example, household income. If you need more information about pre-screening, what I'm going to do is I'm going to direct you back to the PowerPoint we had for our Albany training, which Kara may have sent to you if you didn't attend the Albany training, and to take a look at that. And if that doesn't provide you the answers you need for pre-screening and what it really means, please reach out to Kara. She'll walk you through how to do a pre-screen. The thing to know about the total number of individuals you pre-screened, there's some important notes. First of all, keep in mind this is reported as individuals at the individual level. So for example, if you pre-screen a pregnant mom and her 2-year-old, that's going to count as 2 individuals you pre-screened. So if you pre-screened them, you're going to put them in here, mom and the child. Also include any person you completed the pre-screen with using either the pre-screen checklist, and that's what we learned in Albany, that's what's in the PowerPoint, or that you pre-screened using the online USDA pre-screening tool. And if you haven't seen that tool, if you just started, there's a link to that right in the PowerPoint. Also, be sure to include, and sometimes this can get missed, but sometimes be sure to include any person you find potentially eligible or ineligible in the pre-screen. So if we go back to that mom and child, if you pre-screen them and you find out that they're actually ineligible, you still want to count that as 2 pre-screens, because that's all we're counting in this first area, this first box, is just number of pre-screens. So it's those who are eligible and ineligible that you did a pre-screen for. And also best practice, and you'll see why this is a best practice going forward. Best practice is to secure the individual's name, their contact information, and the client authorization form. Okay. If you're not able to secure this, but you still completed a pre-screen, make sure you include this person in the number of pre-screens. But best practice is to get a client authorization form, get that person's contact information, and their name and their name spelled correctly, so you can follow up with them later. Okay, now right under here, you'll see we have our number of individuals referred to each WIC agencies. So once you pre-screen an individual and you find them potentially eligible, you pre-screen, you find they're potentially eligible, now you're going to refer them to a WIC agency. And you want to make sure, excuse me, and where they want to go and set up their appointment for their certification. Again, excuse me, again, this is one of those situations where, like with so much of human services, it's client-driven. So you'll work with that client after you pre-screened them and found them potentially eligible to find which WIC agency in your service area you want to refer them to. Maybe somebody works in near one agency and lives near another, and they'll decide which one is most convenient for them to go to in your service area. Also, remember, for this number includes all individuals you refer to each WIC agency, whether it was your guided referral, which means you sat down with them and you made the call and you set up the appointment, or if they took the information, you pre-screened them, you found them pre-eligible, they took the information and they set up the appointment themselves. Okay, so you want to include both of those groups in this pre-screen. And again, keep in mind, client choice guides this to what program, or what agency they want to go to in the service area. So now let's just go and let's enter some numbers here, and so we can see how this works. All right, so for December, I'm going to say, and I'm making this up, I can say that I pre-screened, I pre-screened 40 individuals. And I have 3 agencies in my area. And of those people I pre-screened and found potentially eligible, I referred 15 to Albany Medical College. I referred 15 to Whitney M. Young Junior Clinic, and I referred 5 to Schenectady County Public Health. Well, you can see this, I pre-screened 40 people, but this doesn't add up to 40, does it? It adds up to 35. The reason is I pre-screened 40 people, but of those, 5 I found to be ineligible. And so my number of pre-screening is up here, but these are the folks I referred because I found them potentially eligible. And when you go down, you plug in these numbers, you hit enter, and there is your number, the total number of individuals referred to your WIC agency or agencies. It might be one, it might be multiple. Now we're going to head down and we're going to look at this next section. tracking information, the tracking information section. And for tracking information, this refers to the number of people confirmed through your WIC agency. So periodically, you'll send a list of all the individuals you have referred to the WIC agency for confirmation. Okay? That's one reason why you want to get that contact information. The agency is then going to notify you if the individual was approved for WIC benefits, denied, or that they have no record of the individual. Now, how you work out this relationship with your agency is going to be up to you in your local WIC agency or agencies. How often you'll submit that, in what form, that will be dependent upon that relationship you work out with your agency. Under there, you'll see the number of individuals. Let me grab the pointer here so I can point this. Individuals you obtained contact information from. This line here will populate, the spreadsheet will populate that number for you, dependent upon the information you enter below. So there's nothing to enter here. The system will do that for you. Now we're going to go down and we're going to look at the number of individuals contact information you sent to each agency. And this is the total number of individuals you attempt to verify through the WIC agency. For example, you may send the WIC agency, in this case, maybe it's Albany Med, an Excel file with a list of individual names you referred to their agency over the last week. Maybe that's how it's been worked out for this particular WIC agency. Your client's outcome information will be tracked solely through your confirmation with your WIC agencies. So once again, it's important to work with each WIC agency to determine the best way to follow up about your client's WIC determinations. If you need a client authorization form, by the way, because most often they're not going to give you that information without client authorization form, you can use your own agency's form. If you don't have one and you need a sample, a template, please reach out to Kara so we can make sure you get a sample client authorization form. So let's go through and put in some numbers here. And we will put in some numbers again, fictitious numbers. I'm going to say the number of individuals I have contacts for that I submitted to Albany Med to be confirmed is 15. Okay. And what I found is that of those 15, 13, Albany Med said, were approved. Yay. Unfortunately, one was denied, and one person they have no record of. I sent over that contact information. They came back and said, we have no record of this person. Now we'll go down to Whitney Young, and I sent over 12 to be confirmed. 11 were approved. Nobody was denied. Fantastic. And the WIC agency has no record. We're going to say 1. I'm going to scroll down a little bit now. And we're going to go to Schenectady County Public Health. And I sent over 4 to be confirmed. He was denied, and they're not missing any records. So now what happens is we'll come down and we'll see the number of individuals confirmed approved. And this number is the total number of approved through your tracking with the WIC agency. And you can see the spreadsheet does that for you. You can see that number that were confirmed was 28. They were able to confirm 28. Now we have a cumulative success rate. And your cumulative success rate, this is the total number of individuals approved divided by the total number of individuals with a determination, either approved or denied. And this number is used in what's called the main target formula that determines your main target result. Okay. Which brings us down to main target, right here in bright, nice red. And by the way, ignore the numbers here along the side. Yours is going to look very, very different, okay? Because some of you might not have all these agencies, some might have more, so don't look at the numbers over here. we're going to come down to the main target result. Now, your main target result, that's the total number of people who receive WIC benefits based on your work as a WIC health specialist. And that's the big goal. That's what you're working towards. And seeing those numbers when you're having a really good month, that's where you're going to start feeling really good. When you move forward, you're up and running, you're going to start to see these numbers grow. You're going to establish a relationship with community organizations. You're going to get your information out there, and you'll see these numbers grow. Okay? Because remember, we actually have 6 quarters to work with. Only in the first quarter. We've got 5 more to go, plus some time in December. Again, I want to reiterate, don't panic. We know you're just starting. All right. Now we're down here, percentage of total referrals tracked through the WIC agency. And there's some things to know about tracking. For tracking, you're only going to be able to track individuals you have contact information for, obviously. So again, to the extent you can get contact information, the correct spelling names, that's fantastic. And that's really, really important. We're asking you to actually track your clients in 2 different ways, and I'm going to go through it and explain that. The first is through your WIC agencies. We just talked a lot about that. You're going to, for those individuals you have your client information, contact information for, you're going to send them to the respective WIC agency where you referred them. So the first is through your WIC agencies. This is the information that will be tracked on your main target page in the sections with your WIC agency name. That's the page we're working on, and be used to determine your main target number. You will need to track at least 35% of the total number of people you refer to WIC. You want to send to WIC all the people you have contact information for, even if it's higher than 35%. So I'm going to say that again, because that's super important. You will want to send to WIC for confirmation all of the people you have contact information for, even if it's higher than 30%. And this tracking percentage is the total number of individuals you have contact information for divided by the total number of individuals referred. Don't worry about the math. Your main target page will do that for you. The purpose of this tracking is to find the most accurate approval and denial information for your clients. So you're going to reach out and get the best information you can, and the way to do that is you're going to reach out to the WIC agency or agencies and get a report back from them, approved, confirmed, approved, denied, or no record. Now, the second way of tracking directly related to your clients is directly with your clients, to reach out to your clients. Again, you need to track at least 35% of the total number of individuals you refer to WIC.
Show the tab.
Yes.
Yeah.
And
it's under the feedback.
Under the feedback tab, that's right. I'm sorry.
Yeah.
Kara's given me some help here. We're jumping over to the feedback tab.
So yeah, this is the second place where you will be tracking. It's the second form of tracking, and Diana will explain it.
Yeah, this is on the feedback tab. It's the last tab, the first section. Thank you, Kara. That's why Kara and Patty are here. Strength in numbers.
Yeah.
So the second way, again, you need to track at least 35% of the total number of individuals you refer to WIC. And because you have their contact information, you will receive outcome information from your WIC agency, because you're going to submit everybody you have contact information to the WIC agencies. And you should still follow up with clients to see how their appointment went. Really, really important. Just because you get the confirmed, denied, or no record follow-up from the WIC agency, you still want to and need to follow up with your clients. That's extremely important. That's part of what you need to do as a WIC health specialist. So therefore, those you follow up with are likely the same you track to the agency, because you're getting that list back. And these clients can count towards both those tracking percentages. But following up with your WIC clients after their appointment is really important, because you're going to get feedback. You're going to get feedback about the experience. You're going to get feedback about possible barriers to WIC too, and that's really important, because tracking barriers is also part of your job, and it helps you really learn what's going on in your WIC agencies. Also, try to follow up with a variety of outcomes, not just the approved or not just the denied or the no record. Try to follow up with as many as you can, with some approved, some denied, and some no record. Approved individuals are going to be able to tell you about their experience at WIC. Denied individuals, you may encounter a barrier. Maybe you'll find out that they were denied because of something that the WIC agency did, because there was a misunderstanding. They didn't know, the person who was doing the intake didn't know quite the right questions to ask. You might be able to work with that individual. Maybe they were wrongly denied. Right? And also to give you some idea of why people are being denied as well. And then for individuals where there's no record, it might be that there was something simply like their appointment time hasn't arrived yet, or it might be you can provide some kind of a client assistant to them. Maybe it was a simple misspelling of a name. So you want to make sure you follow up on approved, folks who are approved, denied, and also no record. So just to recap, if I can do a little recap here, we're going to go back to the main target because we jumped. And so you're going to get this form. Some of it's going to be filled in by Kara. It's going to come to you every quarter. You will enter your information from the number of individuals pre-screened, then those that we referred. Then you'll break it out individually. And then once you get your information back from your WIC agency on who was approved, who was denied, and who they have no record of, you'll enter your numbers there. And then you'll come down, you look at your cumulative success and your main target number. And notice your main target number, they're a little bit higher than your cumulative success. And the reason is the main target formula behind the scenes gives you a little credit for those individuals you may talk with, you may pre-screen, you find them potentially eligible, and then you go to get their contact information and they go, oh my goodness, I gotta go get my kids off the bus. So that formula gives you a little bit of credit for those folks that we know are going to go and apply and get approved because they had contact with you. It's just a little bit of credit for the work you do for those individuals you do not have contact information for. Right? But you can see the bulk of these numbers come, obviously, from those numbers that you input where you have direct contact information. Right? And then just to look down a little bit, I just want to show you the quarterly statistics table. Nothing for you to enter here, but this is a good summary. It's a good way for you to keep track of where you are in your total progression towards, for example, your main target number. You'll see that with the numbers I input here, I am 18% towards my main target number, just about where I want to be if my main target is 400. Right? But again, that 400 is completely a fictional number. It's going to be different for each one of you. Now, I'm going to just take a breath, and we're going to check for questions. And again, if you have questions, please enter them in the question box. Send them along. We're just going to take a brief moment just to make sure there's no questions, because sometimes there's a tiny lag before it gets here. Okay, looks like there's no questions. Again, I would encourage you to write your questions in the question box as they occur to you, and then we will check them periodically.
I got one question.
Oh, we have a question. Yay!
All right. So the first question is, I thought a pregnant mother counted as 2 individuals. So you can refer to the training PowerPoint. I think we talked about that in the afternoon of the training. It is up to the mother if they decide to count as 1 or 2, if they want to count their unborn child as an individual in the household or not. So defer to them for that.
Very good. Excellent question. Okay, now we're going to move on to the Outreach tab. Again, we're going to go to the bottom of the page. You'll see your tabs along the bottom. I'm going to click on the Outreach tab and bring this up. And let me just, I think we're a pretty good zoom here. All right, the Outreach tab. That very first line you'll see at the top, number of individuals that contacted WIC Health New York for WIC assistance because of outreach. You don't need to enter anything there. The spreadsheet is going to do that for you. Again, that first line, the spreadsheet will do it for you based on the number of numbers that you enter below right here. This will populate automatically. So let's look through here briefly. One of the things you want to do in addition to getting contact information is you want to ask somebody, hey, how did you hear about me? Right? How did you hear about this program, the WIC Help New York program? This does a couple of things. First of all, it helps you fill out your form here because we want to know what's really working. And secondly, when you start to do your outreach and you do promotional items and those things that are coming along pretty soon, then you'll start to get an idea over the term of the contract where your outreach is really working, where your folks are coming from. So you always want to ask, hey, how did you hear about me? How did you hear about the program? And then you go through and you enter the information. For example, I had 8 people tell me they saw a flyer. And I had 6 people that heard about me because of presentations. And these numbers will probably be higher, especially presentations and community events. And you just go through it and add to this. The one I want to talk about is walk-ins. Walk-in is maybe somebody comes in and you're part of a multi-service agency, and maybe they came in for to do paperwork for HEAP, for example, and then they came over and talked to you about WIC because they found out that you're in the building. That's a walk-in. And then down below, you can enter as many others as you like. So if there's some other way they heard about you, you can enter those there, the number, and specify how they heard about you. But you have outreach, presentations, and presentations we'll talk more about next, but presentations is when you're talking to a group. Think about it as like giving a talk. Health fairs are community events. A community event is when people are coming up to you. Say it's say you set up at a county fair during the summer. Okay? So you'll want to keep track of how people heard about you. I'm going to just stop for 1 second, see if there's any questions on outreach, on the outreach tab, reporting. Okay, looks
looking good, yeah.
All right, let's go over to our face-to-face tab. Face-to-face is just what it sounds like. It's when you're talking to somebody face-to-face, not an email or not on the phone. It's when you're meeting with them face-to-face. The very first part up here is how many people, face-to-face contacts, where you provided some information on the WIC Help New York program and on WIC to someone. Okay? So the key thing is here, it's someone you educated about WIC.
Who's potentially eligible.
And who's potentially eligible. Yep, who's potentially eligible. Right? Someone you've educated about WIC who's potentially eligible. And we'll talk about some other things later when we get to the collaboration tab, when you go out and talk to professionals. But this is when you're talking to groups that would include people who are likely eligible for WIC. So a presentation is when you do a talk, essentially. So you put in your number of face-to-face contacts. For this first presentation I did, I went there once, the number of presentations, and there were 35 contacts. And where was it? It was at the Head Start of St. Lawrence County Parents Meeting, and that's where it's located. So I know because it's a parents meeting and it's Head Start, there's going to be a lot of folks there who might well qualify for WIC because they have small children and they're low income. So therefore, we can pretty much assume they are potentially WIC eligible when we do that talk. You can also, with presentations, sometimes you want to go back to the same place multiple times. Maybe you go to a certain preschool or go to a library or go to a health center once a month or once every other month. And so in that case, you put in your total number of face-to-face contacts for that quarter. In this case, I've entered 45. How many presentations did I do? I did 2. I put in the dates, and then I put in the location of where I went. Sunshine Community Preschool Parents Group. Again, it's a parents group. And that's how I enter my presentation information. Okay. Now, community events is just the same thing, entered the same way, except a community event is, think about it as tabling. You're going to set up a table. So I had 19 contacts. That was the number of people who came up to me, and I assume they're potentially eligible because they're at a place where you're going to find a lot of people who are low income. They've come up for information to you. So I provided them with info. There were 19 people I provided education to. It was one event. I went on December 7th, and I went to St. John's Church in Messina, and it was a Coats for Kids Day. Again, I went to a Coats for Kids Day, which means there's going to be a lot of low-income folks there with children, which means potentially SNAP eligible folks that I'm educating. I'm potentially WIC eligible folks that I'm educating. All right.
So just to reiterate the difference between community events and presentations. So at a community event, you'll set up the table and you want to include the individuals that come to your table who you provide education about WIC Help New York or WIC to. For a presentation, you would do that to a group of people who could be potentially eligible, and you count all of the individuals you did the presentation for. Just a little bit different. So the community event, you don't want to count everybody at the county fair, right? Yeah,
right.
Only the people that come up to the table and you provide education to.
Okay. Any questions?
I got a question here.
Yes.
Can a presentation to agency staff count as face-to-face contacts?
It cannot, but we have a place where we're going to count that. That's called a collaboration, and we're going to count your good work when you go out in the community under the collaborations tab. So great questions. We have a place to collect that data, but this is, again, solely for when you're talking to folks who may be potentially eligible and you're giving education to about the WIC Help New York program and WIC. So again, it's really people who we are speaking to low-income folks with children. Okay, but we do have a place to capture that, so very good question.
There's also other face-to-face. Yeah, we got it at the bottom.
I forgot to scroll. Yeah. Kara's playing pantomime, telling me scroll, scroll. So yes, there is. At the bottom, there's an other category. Other face-to-face contacts, not through a presentation or community event. What this might be is you go out and you're putting your outreach material in a library, and somebody comes up to you, they see that, and they start talking to you, and you provide them with information about WIC. They say, oh, you know, I have two young children. You know, I have a 4-year-old and a newborn. Wow, this might be something that would be helpful to me. So you tell them about what you can do. You tell them about WIC, and so that's an other contact. You would put it in here. One in a library. Okay.
All right, I got another question.
Yay.
Can all of the people in a mobile food line be counted for face-to-face contacts? I think that would depend on how you are interacting with the people
right.
in the mobile food
right.
line. So if they're in a line and you get to talk to each one of them individually about WIC, or if you're able to present to all of them as a group, then possibly. But it has to be in those two forms.
Right. As Kara was saying, like when you do, for example, when you go to a community event, you know, you set up at your county fair, you're not going to count the 10,000 people who come to your county fair. You're going to count those people who come up to you, you engage with, and you provide information about the WIC Help New York program and WIC.
Great question.
Excellent question. Okay, let's move on to our next barrier tab. So for barriers, what you're going to do here is identify and report to Hunger Solutions New York barriers that discourage WIC-eligible individuals from completing the WIC application process. And you're going to address at least one of those barriers per quarter, again, one per quarter, with the appropriate WIC agency, and you're going to report on it here. So please articulate the barrier in the box. And this is what you need to include in your barrier: the name of the WIC agency, how you identified the barrier, how did you find out about it, and what steps you took to address the barrier with the appropriate WIC agency, and that's whether or not you were able to resolve the barrier. So we just put a small sample in here for you. Albany County Public Health, whatever public health, whatever county, whatever your WIC agency is, that there was a barrier. A woman I referred to WIC, an assistant with documentation, called and said the WIC agency told her that she needed a photo ID to apply for WIC. I called the WIC coordinator and explained what had occurred. The WIC coordinator looked into the matter and told me that the person who was doing the application, doing the intake, was new. The error was corrected and that my client can apply. I called my client and she set up a new appointment, and I will call her to follow up after her appointment. So there was a WIC agency named, there was a barrier. I tried to address that, and fortunately, and in this situation, that it was resolved. So that's how you report on a barrier narrative. You might encounter barriers where when you report on it, it's not yet resolved. For example, once in a while, there might become a barrier where you have tried an intervention. You found out about it from your client, which is where you're going to find out most of your barriers. You found out about it from your client, you've worked on it, you've called the WIC coordinator, and there's still an impasse, and maybe you've called and reached out to Kara for some assistance in this matter. So it's not yet resolved, but you can put that in your barrier narrative. So it may be a case where it's not yet resolved, but you've taken some kind of action to work on it, you found out about it, and now you're reporting on it. And again, it's going to be one barrier report per narrative.
I got a question for you. What happens if the barrier is the same time after time? So it's a repeated barrier for multiple clients.
Okay. We're going to have actually a place to address that in the feedback section later. And I'm going to ask Kara to address that as your contract manager in terms of your day-to-day work.
So if there's a persistent barrier, you should reach out to me, and we can see if there's a policy that I can provide clarification for you to provide to the agency, or possibly connections on my end to possibly maybe resolve that barrier for the future. So if it's something persistent, please let me know.
Okay. Any more questions before we move on to collaboration? Okay. Our next tab along the bottom is our collaboration tab. And I'll explain in just a second a little bit more what collaboration is as we go through our example. Again, this is per quarter. Educate one agency per quarter in your service area. And that can include local departments of government or community organization, other CBOs, about the benefits of collaboration within WIC Help New York program. And please articulate the name and the mission of the organization that you educated, and if this education resulted in any collaboration. So for example, I visited Catholic Charities Homeless Services in whatever county and spoke to a group of social workers and outreach workers. I explained the WIC Help New York program and educated them about the benefits of working with the program for their clients. I provided the staff with outreach materials and my contact information. Then I put in the mission of the Catholic Charities Homeless Services is to provide emergency and low-cost housing and supportive services for individuals and families struggling with homelessness. For the mission statement, you can get that off a brochure, you can get that off agency's website that you've worked with. So this is where you're going to talk about going out and educating individuals about the WIC Help New York program who are staff members. at an organization. You might go out and educate your local government, for example, maybe your local legislators or your mayor's office, so they know that you are working in the service area and in your counties, and that if a constituent comes to them and they're having issues putting food on the table, they could refer to you. You might go to your Catholic Charities organizations if you don't work for Catholic Charities. You may go to homeless shelters. There are a lot of places you can reach out in the community and do collaborations, right? And so the ultimate goal, I shouldn't say the ultimate goal, something that's really great to do is set up a referral system. A referral system is where, hey, I went to Catholic Charities Homeless Services, and they're going to refer to me if somebody comes in who appears like they might benefit from WIC. If I have somebody come in to me and they're talking about, oh, they're going to lose their house in 2 days, they don't know where they're going to go, I'm going to turn around and make a referral to Catholic Charities Homeless Services. We set up a referral system. It's not mandated that you set up a referral system, but it really is sort of the optimal outcome here. Again, you're going to report on this collaboration once per quarter, and these are folks who are not our income or are not our potentially eligible folks. These are staff members, community leaders, for example. Right? Okay. If there's no questions, then we're going to move on to Gita. Don't let this intimidate you. Again, I'm going to say what I said at the beginning of the webinar. If you weren't with us, we know you're just getting started, and we know in particular we have not asked you to collect any of this information on this data page. We understand that. If you happen to have collected some of this information, if you have client intake forms that's there, please put it on your report form for this first quarter. But if you don't have it, we understand. We're just giving you this form. So we are totally understanding of that. Okay. So the data collection form. Here you're going to enter information on the number of individuals you assisted. So let's define assisted. Assisted means first you pre-screen someone, then you found them potentially eligible. Those two steps have to come first. You pre-screened them, you found the individual potentially eligible, and then you did some other WIC health specialist work for them. For example, you called and set up an appointment for them, or you helped them locate their documentation, understand their documentation, for something like that. So again, in this category, it's on the individual level, just like we started with talking about. So it's the number of individuals, and it's how individuals you assisted. You pre-screened, you found them eligible, and you did some work beyond just a pre-screen for that individual. The first thing we have here is some categories, and you'll be able to enter this information because you're doing a pre-screen. With the category, with a category, you're going to be finding out if the woman is pregnant, if she's a non-breastfeeding postpartum woman up to 6 months after giving birth, if she breastfeeds and she's postpartum up to the infant's first birthday, if the individual is an infant up to the first birthday, and children age 1 to 5. So you'll gather all of this information when you're doing your pre-screen. Now we're going to talk about some information that we're going to be asking you to gather. And again, we know you haven't done this. If you've got some info, great. If you don't, that's okay. First of all, what we want you to know is that you're going to need to have some kind of mechanism for collecting this information. You're going to need an intake form. If your organization intake form does not capture this information, or you do not have an intake form, again, this is a place at the CARA, and we can get you a sample form to capture this information. Now, I'm not going to go through every category, but I'm going to start with special populations. Right? Know that these categories are special populations and race, ethnicity. These category, these special populations and race, ethnicity, this is all self-defined by the individual. We're going to ask you to ask, for example, how do you define race, ethnicity? So if the person sitting before you says they're Asian and they don't look Asian to you, you're going to put down Asian. This is all self-defined. As we go through the special population category, if someone says, I'm a single father, you just write that down as single father. We're not going to ask for any kind of proof at all, just single father. Disabled, the person says they're disabled. Right? So this is all self-defined, self-reported when you go through your intake form. If somebody refuses to answer, honor that. That's absolutely fine. You just let them know we asked this of everyone just because we want to make sure we're serving everybody, we're serving all populations, and we want to make sure we cover everybody in our outreach who could possibly benefit from WIC. Okay. Then as we go down, we'll see that there's some other categories here. Interpretation, translation services, and then the languages, including other, please specify. This is where either you do the translation, maybe you have a client who speaks French and you happen to speak French, you can put that in here. You help the client, right here, you translated for one client, or maybe you helped secure translation through a language line. Because all of you all of your agencies have committed to translating, securing translation services. So maybe you had a Turkish family come in, and there were 3, individuals in that family, and so you used a language line and provided language translation for 3 people. Okay. Zip code, pretty self-explanatory, because you have multiple counties, you'll go through, and in some places one county may have multiple zip codes within it. You'll just put how many residents of a specific code did you assist. So 1, 2, 3, 4, 5, I helped one person. 1, 2, 3, 4, 5, 6, I helped 26 in that area. It's just capturing some demographics so that we get a good idea of how the program is working and who you're reaching when you're out there doing your good work.
Diana, do you mind scrolling up to the special population section?
Yes.
So I want to add here at the bottom, it says other, please specify. If you identify special populations that aren't captured in this list, but you realize that it's a group of individuals that you want to, that you're providing services to, please feel free to add. And it will also help us to identify different groups that we might do targeted outreach to in the future, some flyers. So if you see a group that's not represented there, please add you can add a cell for that in the other. If you need to add more cells, like if you identify 2, there's space on this form for 1, but if you identify 2 groups, let me know and we'll figure out a way to edit your form. I might need to give you a password to edit the form because they are locked in the places where you do not need to enter numbers in. Another question I want to address for you is, are we supposed to collect this data going forward? Yes, please start, create an intake form, or I can assist with that if needed, but start collecting this information going forward now that you have it. If you have any from the great work you guys have been doing since September, October, include that in the first quarter report, but going forward, we hope that you can collect this information.
Okay, we'll move on to the referrals tab. The referrals tab is where you're going to capture the referrals you make to WIC agencies outside your service area, outside your service area. So for example, maybe I'm in the Albany-Schenectady service area, and someone is talking to me, and I find out they're interested in WIC, and they appear eligible, and so they want to, but they say, well, I live on the edge of Schenectady County. It's much more convenient for me to go to Schoharie County. Well, Schoharie County is adjacent to Schenectady County, but it's outside my service area. So what I would then do is I would give that person information about Schenectady County Community Action. That's where the WIC office is. Now, I can't follow up with that person. I can't make the phone call. I can't set up the appointment. Think about it as just handing off to any other kind of service. Like if I was making a referral to HEAP or for SNAP benefits, I'm going to give them the information, and then they're going to follow up by themselves, and that's the end of my contact, right? Because it's outside my service area. So what I put in is the number of referrals I made to an outside agency, and then I put in the information on the agency outside my service area I made that referral to. Now, you may encounter a situation where you're talking to someone, and that someone, maybe I'm in the Albany area, and I find out that that person really is interested in WIC, but they're, pardon me, living in Buffalo. And so in that case, I would refer them to the Growing Up Healthy hotline. I don't necessarily know about what the agencies are out in Buffalo, so I will bring up I will refer them to the Growing Up Healthy hotline. And then below that, please specify the number of referrals you made to a WIC Health, a fellow WIC Health specialist. And I'm going to go down here, and I'm going to bring up our map. This map all of you have, and this shows you all our service areas where there is a WIC Health New York program and a WIC Health New York specialist. Okay? So you can refer to this, and on the back is all the contact information. You can refer to this, have this on hand with you. So, for example, if you are in one of the counties, say Wyoming County, and someone has come down from Monroe, over here on the western part of the state, you can say, hey, there is a WIC Health specialist in Monroe. Let me give you that person's name and contact information. Again, you're not going to set up an appointment. It's a handoff. You're just going to provide that contact information to your fellow WIC Health specialist, and you're going to enter that number here. Now, as we go below, we're going to specify the number of referrals you made to other nutrition assistance program or community resources. And this is another part of the work you do because you want to help people. That's why you're in the work that you're doing. Okay? That's why we all gravitate towards human service work, because you want to do a lot of good work for people. So if you have someone and you've been talking to them and you find out that, hey, it sounds like, you know, you might be interested in getting more information on HEAP or a farmer's market, or did you know where the soup kitchen is? This is where you enter that information on your referrals that you make to other community-based organizations. And here, one thing I do want you to look at, just brief, is right here, My Benefits. And My Benefits is an online tool where people can go on, apply for some programs, or just find out if they might be eligible for. And this is, you're going to put in your referrals when you refer people to My Benefits for programs other than WIC, because you're going to be doing that WIC Health Specialist work. Okay? You're going to be walking them through that process and giving them their information. Okay? And then other, you can put at the bottom as many other as you want. For example, maybe I was talking to somebody, I set up their appointment at the WIC office for them, and then they mentioned, oh, I got to get home because I'm having severe problems with my landlord, etc. And you go, well, here's a brochure for the community legal clinic, and you give them that brochure. So you made a referral to the legal clinic, and you can enter that there, or to a furniture program, or whatever it happens to be. Okay? So this is where we capture those referrals. Any questions on referrals, anyone?
All right, I see a question from Erica. I'm going to follow up with you offline to answer that question. Any other questions about the referrals tab? There's a few questions that I'm going to answer at the end. I'll wrap up that go back to other tabs. But if anyone has any questions about referrals while we're here, I don't see any. I think you're good, Diana.
Okay. All right. And last, feedback. The reason this is in here, we're asking some feedback because, as I said at the very beginning, and we talked about earlier, this is a new program. We are just starting out, just like you're starting out, and we'd like to get information about what's happening on the ground in your service area with your WIC agencies. And we'd like to know what's happening that's great and what's happening that's not so great. And so we've set up a place to do that. So in the spaces below, because we did talk about tracking before, so we're going to jump down. If you have more questions on the tracking, you want to go back up and revisit that, we can, but we did that earlier. In the spaces below, please provide feedback, either positive or negative. You experienced or received about a particular WIC agency. So this could be your experience with the WIC agency. It also might be experience that your client or clients are having. And again, positive or negative. And please include experiences that have been reported to you by clients. And something that's really important is please do not in here provide any client identifying information, right? We don't want any client identifiers in here. If you do to refer to a client, refer them to them as, you know, Ms. or Mrs. S or Mr. D or client A, client B, something like that. Please don't make any references to any personal identifiers for these clients, okay? So you'll go down, you put in the name of the specific WIC agency, whichever one in your service area, and the date. The date is the date the incident happened, if it was an incident, or, you know, if it's something that's happened over a period of weeks, just, you know, rough date of when you started hearing this information or when you want to report it. Let me go to a couple examples. On the first, WIC agency, date 12/4/18. I had 3 clients that I referred to WIC call me and tell me they had had appointments at the office to apply for WIC. These 3 clients, Mrs. J, Mrs. R, and Mr. B, all had to wait more than 3 hours after their scheduled appointment time to get interviewed and apply. Ms. J had to leave to go to work and had to wait again on a rescheduled appointment. I've called the WIC coordinator 3 times to ask about the wait times, and she, the WIC coordinator, Mrs. Jones, did not call me back. So I put in the date. This has happened, obviously, over a little bit of time. I put in the date of you know, when I'm reporting this, and so that we know it's been happening for a little bit of time, subsequent or just before 3/12. And we know that the WIC coordinator, Ms. Jones, is not responding. We have Ms. Jones in here because she is a staff person at the WIC office. We can identify her, but again, we don't ever want to identify clients. Okay? Let's flip to something that's positive. Ann Jones Davis, the nutritionist at the WIC agency, has been extremely helpful, and I put in my WIC agency and the date, has been extremely helpful to those I've referred to this agency. Clients have told me that she spends plenty of time with them, never seems rushed, and makes nutrition education easy to understand. So there is a positive. Okay? If you have something that happens on a specific date that is negative, for example, or actually is really great, you want to put in the specific date that happened whenever possible. Okay? So that's what the feedback is. The feedback is to give us some positive and negative feedback from what's happening out there that you're experiencing and that your clients are experiencing. It gives us a little bit of a snapshot of what's happening in your service area. Okay. Any other questions?
Let's see. I don't see any other questions about feedback right now. I see a few people have asked when the reports are due. That's a great question.
So we go back to that very first page?
We can. I left it blank on the forms that they got via email from me.
You did.
That's probably where the confusion came from.
Is this the correct date?
It is. January 15th will be the due date for the first quarter's report. So you'll be reporting on October, November, and December. And it will be due to Hunger Solutions on the 15th of January.
Very good.
I see a question from a little bit earlier that I think is a good one. It's about face-to-faces. So are we supposed to complete pre-screenings at community events and presentations, or only when they contact us because of our outreach, like placing brochures or posting flyers? The answer is both. So if you're in the field, if you're at a community event and it's an appropriate place, the person's okay with being pre-screened right there, and you have, the pre-screening checklist, or you maybe have access to the USDA pre-screening tool there, you can do it right then and there. You can also do a pre-screen when someone contacts you. So maybe you post a flyer and they call you and ask for a pre-screening. They're curious about WIC, and you give them some information. You pre-screen them. You can pre-screen them too. So the answer is both.
We're just checking for any other questions.
Is there anywhere to report on brochures distributed and flyers posted? That is a part of our campaign launch. So we're tying up the loose ends on our first campaign toolkit. And when we go to launch that, I will introduce a form, an outreach approval request form. And in that form, you will include the locations where you post a flyer. So that way, and we know where you've been distributing that outreach. That will be more clear once we get to that webinar and launch. Any other questions? Again, if you have any further questions, please feel free to contact me via email or by phone. I'm happy to answer these, especially as you start to fill them out. There might be some questions you have, so I would be happy to answer any questions you have. I also want to reiterate that the forms are locked in certain places, especially the first main target sheet of the form, because of the fact that there's that formula and there's cells where they do some addition for you. So please don't make any edits to the form unless it's in a place where your information is requested from you. So like the number of people that contacted you due to outreach because of promotional items on the outreach tab, or the number of individuals you pre-screened in December. Those places where you're asked to enter information, please do, but do not change any other parts of the form. If you think there's a place where you want to add something that's not captured, let me know and we can figure out a place to capture that.
And we're just doing another quick sweep through for questions.
Can you please clarify the definition of kinship care?
Kinship care, we've decided that and please correct me if I'm wrong, Patty or Kara, we've decided for the purposes of kinship care, I'm going to pull up the data form so everybody can see where we're looking here. Kinship care. If it's a grandparent, an aunt, or uncle, for example, who's taking care of a child that's not their own. It's not their biological child or their foster child or adopted child. So if the person has that child and that they're taking for that child and going to apply for WIC on behalf of that child, then that would be somebody who's kinship care.
It doesn't mean they have to have custody of that child. It's self-identified. All right, well, that seems to be all the questions.
Excellent, very good. This is Diana again, as you can probably tell, but I want to identify myself while I say thank you so much for joining us today. Again, don't be, as Kara will tell you 8 million times, don't be overwhelmed by the form. Don't be upset because you don't have all these numbers yet. We have 5 more quarters. Some things we're just asking you to start to collect and report going forward. Any questions, reach out to Kara. She will walk you through any specific parts that you have questions on. Much better to ask questions and enter information where you don't know for sure what you're entering. Okay, learn it, get it right from the start. Kara will be happy, as I speak for Kara, but Kara will be happy to answer those questions. And I just want to say on behalf of myself, happy holidays, everyone. Stay safe, stay warm, enjoy the holiday season. And Patty, you might want to say goodbye to everyone as well.
Bye, everyone. Happy holidays. Night.
Okay, with that, we're going to end the webinar. Thank you all and have a good rest of your afternoon.